So, does wearing a mask protect you from the coronavirus? With the new coronavirus going around from China and now spreading globally, people want to know what they can do to protect themselves. And whether or not wearing one of these masks protects you from getting the coronavirus is a hotly debated topic right now. The most important thing to understand is that the researchers are still trying to work out the ways that this new coronavirus is transmitted. Meanwhile, the CDC recommends 4 basic things. 1, wash your hands thoroughly, regularly throughout the day, especially after using a bathroom and before eating. 2, avoid touching your eyes, nose, and mouth with unwashed hands. 3, avoid contact with people who are sick. 4, disinfecting commonly used surfaces. This advice will help protect you from a whole host of infections, including the novel coronavirus. But the CDC does not recommend the routine use of a surgical mask to prevent getting the coronavirus infection. Meanwhile, the coronavirus fears are leading to mask shortages around the world. The World Health Organization just warned of a global chronic shortage of personal protective equipment that could shield individuals from coronavirus. Personal protective equipment does not mean specifically surgical masks alone. It includes surgical masks, N95 respirator masks, gloves, goggles, and gowns. The worldwide mask shortage prompted electronics giant Foxconn, the maker of the Apple iPhone, to set up a production line of facial masks at its facility in China. The company expects capacity to reach 2 million facial masks per day by the end of February. And masks are hard to come by now in the United States as well. The National Community Pharmacists Association on Thursday released results of a national survey that said 96% of local pharmacies are experiencing a shortage of surgical masks, and nearly 40% don't have enough N95 respirator masks. The websites of CVS and Walmart show few to no surgical masks and N95 respirator masks. But what is the role of these masks, and do we really need them? What does a surgical mask do? What does the N95 respirator mask do? So with the surgical masks, they can play a role in preventing the infection, but that role is limited in real-world situations. There's some evidence that wearing a surgical mask can protect you from transmitting the virus from your hands to your mouth, probably because you're paying more attention when you have that mask on. You also have some protection with the surgical masks from splash droplets, let's say if someone coughs or sneezes right in your face. But there are several reasons why surgical masks are not ideal. For one, it's really hard to find one that fits perfectly around your nose and mouth, or to keep it on for a long period of time. The minute you scratch your nose or touch your mouth behind the mask, you've lost the protection that the mask is expected to give you. In hospitals, there are very specific guidelines about when to use masks and what kind of protection to wear, depending on the type of infection a patient has or is suspected of having. For example, when a patient is said to require droplet precautions, that means healthcare workers need to use a rectangular surgical face mask. These surgical face masks are intended to prevent infections that spread by large droplets when someone coughs, sneezes, or talks. This includes infections like influenza, whooping cough, and meningococcal meningitis. After every interaction, caregivers dispose of the mask and use a new one anytime they're in close confines with an infected patient. Then there's airborne precautions. Some lung infections and some throat infections spread when small viral or bacterial particles stay suspended in the air and can be inhaled by other people. The 2019 novel coronavirus is believed to fall into this category. This category also includes other viruses like the SARS virus, measles, chickenpox, and tuberculosis, which is actually a bacteria. In these cases, all people coming into close contact with the patient should wear a N95 respirator mask. These N95 respirator masks have a special air filter designed to protect from tiny airborne particles. Unlike a surgical mask, they fit to a person's face and are usually rounded in shape. In theory, all the air a person inhales is filtered through the tiny pores in the mask. And because the novel coronavirus is thought to spread through contact, droplet, and airborne, the most appropriate mask to prevent inhalation would be a N95 respirator mask. While researchers continue to learn more about how this new coronavirus spreads, the recommendations around masks focus on people who have the infection or are highly likely to be exposed. People who actually have the coronavirus infection or are at risk for being exposed should wear a surgical face mask. and anyone caring for someone infected in a hospital setting or other medical setting should wear an N95 mask as part of airborne precautions. For the rest of us, the best protection is hand washing, avoiding sick people, not touching your face with unwashed hands, and disinfecting commonly used surfaces. These measures also help prevent colds and flu. If you choose to wear a surgical mask, make sure you have the best fit possible around your mouth and nose, and properly dispose of the mask and put on a new one anytime someone coughing or sneezing around you contaminates it. So that's all for this video. I'll be having more videos on coronavirus as there's more and more updates. So I'll see you in the next one.